Parkinson's disease. Parkinson's disease was initially described by James Parkinson, and here the main pathological basis for Parkinson's disease is degeneration of dopaminergic nerves in neurons in substantia nigra pars compacta. So the striatal dopamine levels are very low in Parkinson's disease. Age of onset is usually elderly, it's 65 years old and slightly higher in male population. The causes for Parkinson's disease main thing is idiopathic Parkinsonism, and that is the most commonest reason, and also drug-induced Parkinsonism is there. Apart from these two, very rarely that can be associated with trauma and also toxins like copper. So in Wilson disease you can have Parkinson's disease. Parkinson's disease is characterized with 4 cardinal features. There is a tremor. This is usually asymmetrical and initially start in unilateral but spread to bilateral anyway, stay asymmetrically throughout the course. It's a resting tremors and it then fade out with work actions and sometimes become absent. And also it's a typically pill rolling tremor. And also the other feature is rigidity, and because of rigidity we can elicit the sign of cogwheel rigidity when it's combined with tremor. When the tremor and rigidity come together, it's we can feel it's a cogwheel rigidity. And other cardinal features is bradykinesia. Bradykinesia means slowness of body movements. All the movements get slow. It's so patient become monotonous and very slow. There is a freezing, and so the stoop posture and festinance gait. Because of these things patient became and also there is micrographia, very small letters they are writing like that. Everything became bradykinesic, akinesic, very slow. It is the main feature of Parkinsonism. And also other feature is postural instability. In Parkinson's disease, postural stability comes in the later stage. If it's occur in the early stage, we should think about another cause for Parkinsonism. Like in idiopathic Parkinsonism, it comes in the very late stage. But in the other form of Parkinsonism, Parkinson plus, there's an entity called Parkinson plus syndrome. And in those things, it's come early. So we have to think another entity if we detect the postural instability in early stages. Apart from these things, there are neuropsychiatric manifestations of patients like depression and dementia. So when treating patients, we should address these things as well. And also they are having constipation and urinary symptoms like frequency, incontinence, and also hallucinations, visual hallucination they could have. When considering treatment, actually Parkinson's disease, the main pathophysiology for Parkinson's disease is a dopaminergic nerve deprivation, or the reduced level of dopamine in the striatum. So if we can replace dopamine level, or if we can give medication that release dopamine, it will reduce the symptoms and can act as a treatment for Parkinson's disease. So the main drug of choice is levodopa. When a patient ingests levodopa, it's transported to the central nervous system, and it converts dopamine by decarboxylase enzyme. If this conversion occurs in the peripheral blood system, it gives rise to the side effects like nausea, vomiting. So we can actually use medications to inhibit this carboxylase in the peripheral blood. So then the side effects will be less. So carbidopa is a drug of such action. And a dopaminergic agonist we can give to these patients, and also monoamino oxidase inhibitors we can give, and other drug is COMT inhibitors. Not only that, we can also there are other physical form of treatment like deep brain stimulation, and also tissue transplantation, and also ablation therapy is also there. And also the main thing is physiotherapy and psychological support to these patients because they have a neuropsychiatric manifestations. So this is an overview of Parkinson's disease and its pathophysiology, manifestations and treatment. Thank you.